Hi doctors, let's talk about something that's probably slowing you down more than it should. Prior authorization. Yep, that familiar gatekeeping process we all have to deal with where insurers decide whether a medical service, procedure, or even a prescription is medically necessary before they'll pay for it. On paper, it sounds reasonable: control costs, prevent overuse, ensure appropriate care. But in reality, it's often a bottleneck. A frustrating, admin-heavy step that delays treatment and drains your team's time. Here's how it usually goes. You or someone from your team submits a request to the payer. Then comes the wait. The insurer reviews documentation, checks their policy rules, and then, maybe they approve, maybe they deny. Maybe they ask for more information. Sound familiar? Now, from the insurer's side, it's all about managing costs and reducing unnecessary or duplicated services. But from your side, it can feel like a broken system, especially when it leads to delayed care, denied claims, or patients left hanging. And here's the kicker: if you don't secure the PA before service, your claim might get denied. That means lost revenue, denied payment, and one very unhappy patient. It's a high-stakes step in the revenue cycle, and one that's only getting more complicated. But that's where teams like Staffingly step in. Staffingly provides full-service prior authorization support, handling the entire process end-to-end so your clinical team can focus on what matters: patient care. They've got trained specialists who don't just submit forms, they know the nuances of payer rules. They make sure every request is documented properly, coded correctly, and followed up promptly. And if a request is denied, they handle the appeal process too, from gathering clinical justification to re-engaging with the payer until it's resolved. Staffingly uses real-time portal integrations and automation tools to cut down on delays, reduce human error, and speed up approval timelines. Their workflows even sync with most EHRs and billing systems, so your staff isn't bouncing between platforms. And because payer rules and regulations change constantly, Staffingly stays up to date, making sure your submissions are always compliant and audit-ready. That's one less thing you or your practice manager needs to worry about. We're starting to see AI tools that can predict which services need approval and even help generate the required documentation in real time. Interoperability between systems is improving, and real-time authorizations are starting to pop up across some payers. Eventually, we may even see a shift toward more patient-centered approvals, where what's best for the patient becomes the priority, not just what's cheapest. But until we get there, outsourcing your prior authorization process to an experienced team isn't just a time saver, it's a revenue protector. You get faster approvals, fewer denials, and way less administrative chaos. So doctors, if prior auth is wearing your team down, consider giving it to the people who handle it best so your clinical hours can stay clinical. If you found this helpful, hit like, share it with your practice group or colleagues, and subscribe to the channel for more content built just for healthcare providers. Thanks for watching, and I'll see you in the next one.